But first, two examples of our new health fascism, two examples of cowardly politicians causing terrible cruelty by letting health bureaucrats have the last say in how to deal with the coronavirus. Health bureaucrats, of course, are always going to cover their own backsides and say safety first, without taking into account other things like people's jobs, people's freedoms, and their relationships. Example one is from Queensland. A couple flew in fully vaccinated from the Middle East, repeatedly testing negative in quarantine, and had their baby son born prematurely last week while they were still in quarantine. That baby was instantly taken to a hospital ward. To this day, the couple have not seen him. They aren't allowed to see him in hospital.
There's no words to describe how I'm feeling. I just want to see him.
Now, to repeat, this is a couple fully vaccinated, repeatedly tested. The chance of them infecting people is so low that you could hardly measure it, especially if the hospital took extra precautions for a visit. But no possibility is too low for the state's chief health officer, because that's her only measure of performance, removing every possible risk, no matter how tiny.
These are always really, really tough decisions, but they're made based on specific health principles, which is about keeping the three people involved safe and keeping other people in the hospital safe.
In fact, this should be a decision made by a brave, brave politician who listens, yes, to medical advice, always listen, but also considers the wider picture, other factors. But no, too scared or too lazy. For the sheer hypocrisy, though, Queensland Premier Annastacia Palaszczuk instead could yesterday tweet, "Great news, she just got the Pfizer vaccine, so she could travel to Tokyo for the Olympics." But two parents who got the vaccine can't even visit their own baby in hospital in Brisbane. Only, suddenly Palaszczuk says, well, that's not a decision for me. That's not a decision for me. And we saw this same abrogation of responsibility in Victoria. I mean, where else? Last week. A poor, poor family in Warrnambool, in Victoria's west, on the coast. They wanted to hold a funeral for their 8-year-old son. He'd drowned on a school outing. But there was a statewide lockdown. Funerals could have no more than 10 family and friends. And the family appealed for this to be relaxed. And again, the health risk was so small you couldn't even calculate it. The nearest infected person to Warrnambool was in Melbourne, 250 kilometres away. In fact, every known Victorian with the virus has been in quarantine for days. The funeral could also have been held very safely in the open air, given that almost no one has ever caught the virus outside that we know of. And there could have also been social distancing, face masks, the whole thing, perfectly safe. But no. Here too, again, cowardice. No judgment, no compassion, just the rules. Victoria's acting Premier refused to make the decision to exempt this family, and even its chief health officer left it to more junior health bureaucrats to decide. Everyone handballing.
And I did ask the public health team to reach out to the family, and I know that they did, but I might ask Professor Sutton to make some comments.
The exemptions team did speak to the family and did assess the request. I wasn't personally involved. The Chief Health Officer doesn't have a role appropriately, and I understand that the request was declined.
But of course those more junior health bureaucrats said no to a normal funeral for this boy. Why would they risk their careers by taking even the most remote chance when their own political masters won't? Where is it in their job description to show mercy? So this should have been another decision for the politicians, but in states like Victoria and Queensland, the political leaders lack the courage to make them. That's why some states, New South Wales a shining exception, some other states, of course, have this health fascism. It's a rule by paranoid health bureaucrats whose job is not to consider anything except health. Not the economy, not your freedom, not the hell that they're putting people through. And you've got politicians too scared to countermand them or to rule with other factors taken into account. And that's why Melbourne has been locked down for the 4th time, for 2 weeks, for no good reason. Today, just 2 more new infections, just 2, and again of people who are in close contacts already in isolation, which shows that no, this absolute beast of a virus has not been roaming around the city infecting lots of people since the lockdown was imposed, nor has it killed a single person in this outbreak, not even the 99-year-old who was infected. I can't think of another big city in the world. Can you? Who would be locked down because of a virus outbreak that's killed nobody and infected just 2 people already in isolation in the previous 24 hours. That idea is so insane that even this cowardly Victorian government admits that, all right, it might have to lift the lockdown on Thursday.
We remain on track to have some easing of restrictions announced this week.
But of course the lockdown must end. Half the reasons given for it have proved false or redundant. I mean, first the government said we needed a quick lockdown just to give the contact tracers some breathing space to catch up with the virus. Well, they got that breathing space, they caught up, and Melbourne's still locked down. Then it was because, oh, well, look, this latest strain is a beast. It's infecting people in ways and places not seen before, even in the open air. Complete beat up. False. Based in part on 2 false positives. And then it was, look, suddenly another strain's appeared out there, maybe from New South Wales. Who gave it to them? We have no idea. There could be lots of these cases. Well, today, oops, the Victorians now admit, well, it actually got out of one of our quarantine hotels, brought in by a traveller from Sri Lanka. Our testing didn't quite pick it up. Total joke. The Prime Minister is sure pushing Victorians to now be reasonable, at least pushing the government. I think Victorians have had enough, pushing the government to be reasonable and ease up.
I want to see restrictions lifted in Melbourne as quickly as possible and as safely as possible. The case numbers today, I think, are very welcome, and I'm sure that is encouraging to people in Melbourne.
Perspective. This virus has not killed a single Australian this year, not through community transmission. But perspective, it sure killed that.